Welcome back to Skin Deep Sessions. We had a great response last week with our live demo, and we did ask you guys to send some recommendations in of what you'd like to see, and the Profhilo was a really popular one. Now, Vanessa was already booked in this week to have her Profhilo done, so we're going to do a bit of a demonstration today, but we're actually going to be demoing the Profhilo Structura. So that's the newer Structura, the newer Profhilo. I know we have talked a bit about this in previous episodes, so hopefully you've managed to catch that, but I will give a little brief overview today anyway. So the Structura is a little bit different. It works... Well, actually, I'll just introduce it first. So it comes in a box like this. Really important that you make sure it has the holographic label on. You need to be able to trace it back to the source and make sure it's a genuine product. So you do that by making sure there's a holographic label on your box. Inside the box then we have a little booklet. We've got the stickers, so that again, traceability, we know what we're using, where it's come from. And I like to give the patients one of these to take home with them as well, just for their reference. And then we've got the product, comes in 2ml syringe, but you'll see that a little bit more later. Now the main difference with the Structura is that we use a cannula. So the original Profhilo is injected in 5 points across the face, measured up each side of the face. This one's a little bit different, we use a cannula. So in the box, they do send 2 different sizes of cannulas. That's because there's 2 different techniques that can be done. Again, I'll talk through that a little bit again in a minute. So I've already taken mine out of the box, so I've got my cannula here and my entry needle here. So that's just a little bit of an overview of what comes with the product. So I'll talk a little bit now about what we're going to do today. So Vanessa's had this treatment quite a few times now, and obviously happy with the results because she's back again. So we're doing a top-up this time. Now last time we did it, we did the Saggers technique. Now the Saggers technique is for somebody...
It sounds awful.
I know, it sounds really bad, I know, I'm sorry. But the Saggers technique is really good for where you feel, if you're looking at your face and you feel like that tissue and the fat pads are almost slipping off the bone. You know, they're slipping away from where they should be. You're losing that volume in the mid face, the middle cheek especially, and you just need something to almost like pick that tissue back up again and just give you a little bit more structure in your face. Now, the other technique is called a sinker's technique. So that's
just as glamorous.
That's a little bit different because with the sinkers, that's more focused on people that actually your structures are quite good. Things are where they should be. You know, things don't look like they're sagging too much, but you might notice that you're getting some hollowing in this area, this middle area of the face. You're getting some hollowing. You know, one of the biggest signs of aging, we're losing that lovely, full, healthy look that we used to have in our face. If you look at children, you look at teenagers, they've got that lovely, full, glowing face. So we're starting to lose that, and it's just a natural aging process. It happens to everybody, you know, it happens at different rates, but it's just the natural aging process. So last time we did do the Saggers technique on Vanessa, but actually things are looking pretty good the way they are right now. So we're going to go for the sinker's technique today, just to address a little bit of this hollowing that we've got here. With the 2 techniques, well, I mentioned there were two different cannula sizes. That's because the injection is slightly different. So with the Saggers technique, we would make an entry port here for our cannula, and we would leave 0.5 ml of product just underneath the zygomatic bone here, and then we would leave 0.5 ml of product in the preauricular area here. So you think like a bit of a 90-degree angle, we're leaving 2 lines of product. With the sinker's technique, which we're going to be doing today, we do use a slightly longer cannula, and that's because we are only injecting in the preauricular area. We're not doing anything across the zygomatic area, we're just going straight down here. We will mark out our safety areas because we know with anatomy, we do need to mark out about 2 centimetres away from the tragus here, just to make sure that we're away from any facial artery branches, anything like that. just to avoid any complications. So what I'll do now is I'm going to clean the skin and do my markings, and then we'll get started. So I'm just going to measure up here now our safety zones. So I'm going 2 centimetres away from the tragus for this technique, right here, and then we'll draw a line straight down here. But we also want to stop about 1 centimetre away from the mandibular bone here. So here. That. So I've attached my cannula now, ready to start the treatment. A lot of you might be thinking, what's a cannula? That looks really scary, but it's nothing to be afraid of. It's actually pretty pain-free. We do use a smaller needle initially. So this is my smaller needle here. And we'll use this one just to make an entry point on the face. And that's where we will then be able to feed the cannula in. So now the cannula is a longer needle, but actually the end is blunt, so there's no sharpness on the end of this needle, and there's a small entry port on the side, and that's where the product comes out of. What this means is that we can feed it through the skin. It's not sharp, so it's less likely to penetrate any vessels or anything we don't want it to do. We can be really gentle with it, and it almost just glides through, quite nicely. And we can, we use these a lot for fillers as well, because it gives a much better result, a much safer result, less risk of swelling, bruising. But yeah, you'll be able to see what I mean by that now. So, gonna be a little sharp scratch now initially, okay? Into this port that I've made, just like that. Now, we do need to sometimes just lift the tissue just to guide it through, and then we're going to feed it all the way down, just to the point where we've marked our safety area. There we go. So we're in there now, and you can see the cannula's just sitting into that superficial fat area. Okay, and how are you? Are you okay there?
Absolutely,
Yeah?
I felt the sharp prick of the little needle, but I can't feel that at all.
Brilliant. So now I'm going to start slowly depositing the product as I pull the cannula back out. Now we're going to be leaving around 1 ml of product each side. Go. So that is that side done. Now you might be able to see we've got a little line of product here on the side of the face. Now that's completely normal. That is where the product's been deposited, and over the next 12 hours, 12 to 24, some people do take a little bit longer, that product will disperse into this area here, this preauricular area, and what that's going to do is just give that tissue a nice bit of support, and just help to replenish that area where we're losing volume. Feel okay? So if anyone's got any questions about this treatment, or even if you're thinking, is this treatment suitable for me, or is this Profhilo suitable for me or should I go for the other one? We offer a free consultation, so please book in, come and have a chat. There's no obligation at all. We can just give you the information you need and do a nice full assessment and see what we would recommend for you. But please make sure that you like and subscribe to our videos. Let us know if there's anything that you'd like to see in the next one. Again, we're happy to do live demos, we're happy to talk about anything that you'd like to know a bit more about really, so just let us know. And we'll see you next week.
Thank you.